Welcome, everyone. I'm here today to introduce an area of practice that can affect anyone worldwide. Whether you have experience personally or would like to know the basics of what to expect, this training will provide guiding principles from a social work perspective. My name is Crystal Weiss. I'm a licensed clinical social worker and certified clinical trauma professional. And our training today is the process of aging, how it relates to neurocognitive diseases. The goal for today is to provide a general overview and understanding. A little disclaimer, please do not feel overwhelmed or obligated to know every specific detail about how our bodies age. There will be a brief overview on key areas that are affected. Let's review some basic areas that we will cover today. We will start with an introduction, talk by the numbers, review various myths and misconceptions, review the aging process, discuss neurocognitive diseases, help and resources, and wrap up with social work approaches and considerations. But before we can begin, here's a little about me. I was born and raised in central Pennsylvania, and I'm currently employed by a large hospital system. I graduated with my bachelor's from Bloomsburg University in 2011, my master's from Marywood in 2013. I've worked in the field of addictions and mental health, serving populations of children, adolescents, and their families. Most recently, I've been working with older adults. My clinical focus surrounds neurocognitive disease process, and the recent positions that I've held were in inpatient geriatric psychiatric unit and also inpatient case management. Earlier this year, I became a clinical social worker, and some self-disclosure, I've personally used material from Agents of Change to pass with the exam. Introduction about aging. When you think of that word, what comes to mind? Do you associate it with someone growing old gracefully, or attribute it to grumpy old men or persnickety old women? Modern film and media have shaped our perception of what aging is and what it isn't. This certainly can be another topic for future discussion, but it contributes to how the process of aging is viewed. Although inevitable, the process of aging should not implicit a negative worldview. Let's talk about the field of aging. The Greek term, the abbreviated term, means the study of old man, which was first coined by Elie Metchnikoff in 1903. However, the official organization and recognition as a field of study did not occur until the 1940s. In that particular field of study and recognition is called gerontology. It is the study of aging processes in individuals across the lifespan, consisting of a multidisciplinary approach. A multidisciplinary system is necessary to understand the specific changes in society an aging population can affect. So gerontology. Specific focus is on the physical, mental, and social changes in people as they age, changes in society from an aging population, and how this can be applied to policies and programs. So why is a multidisciplinary perspective needed in the field of gerontology? Professionals in this field contribute invaluable knowledge and skills surrounding public health, policy, psychology, biology, and also the social sciences. Individuals who study in the field of gerontology, which can include doctors, nurses, researchers, psychologists, and social workers, are called gerontologists. The Gerontological Society of America defines gerontologists as ones who focus on improving the quality of life and well-being of older adults through research, education, practice, and application of their knowledge base. Let's not confuse the terms gerontology and geriatrics. Geriatrics refer to the branch of medicine that specializes in the treatment of diseases in older adults. There are a few distinct differences. Just remember, geriatrics is a branch of medicine. Gerontology includes the various psychology, biology, social work perspectives that deal with the changes in older adults as a population. Now let's look at by the numbers. We can see the trajectory that has already happened over the last 50 years in American society. We have seen the marvels of how science and technology have shaped our future. Because of this, we have seen an increase in life expectancy due to advances in modern medicine. And here are just some numbers that I have picked from mutual resources here to really reflect the reasons and the projected need for knowledge and working in this field. By the year 2060, the United States life expectancy is projected to increase by an average of 6 years, from 79 in 2017 to about 85. The overall size of the older adult population will also grow by 50% between 2016 and 2030. By the year 2034, adults aged 65 and older are projected to outnumber the population of under 18. And by the year 2060, 1 in 4 Americans will at least be 65 years old. So a few areas to look at here. Why should we, as social workers, and just in general, be concerned about growing numbers of older adults in our society? And as social workers, how does our training and education help prepare us to work with this population? So we will review the first part. Why should we be concerned? Living longer. There's a growing need for professionals trained in understanding the diverse aspects of the aging process. As we continue to grow older, so does our need for goods and services. So let's break that down. Living longer. There will be a growing need for social workers, psychologists, doctors, researchers, and knowledgeable caregivers to work with our aging population. Varied physical, emotional, and social needs. As social workers, we're versed in understanding the biopsychosocial needs of a person and can utilize this practice framework. We will reference the person and the environment theory. Using a model of care grounded in social work, we understand the need to look at the whole picture of a person and how it can affect various aspects of their life. And lastly, a global impact. It affects economic growth, trade, migration, disease patterns and prevalence, and fundamental assumptions about growing older. As we continue to have an aging society, it puts further strain on a system that's currently not equipped to handle the specific needs of the population. To answer the second part of our question, as social workers, how does our training and education help prepare us to work with the population? Through our training and education, we use our code of ethics, which places values of the social work profession at the forefront for potential areas of growth and need. Our core values encourage us to think more broadly, continue to learn and grow, and recognize the potential an individual has, no matter their age. With this demographic shift as professionals, we would need to enhance our competence, continue to advocate for unmet needs, and understand a culturally diverse population of adults. Some of our coursework during undergrad and graduate school has helped and provided a brief overview of aging across the lifespan. With varied field placements and even employment opportunities, this can help shape career paths and interests in working with older adults. Our core values include service, social justice, dignity and worth of a person, importance of human relationships, and integrity and competence. All of these core values are used in working with an adult aging population. Now we will move on to aging, the myths and misconceptions. But before we begin, what are some of your thoughts about aging? Are you scared, excited, or worried? How are your perceptions shaped by your experiences with other family members and friends? What common remarks or phrases have you heard? Are they mostly negative or positive? Why do you think there are varied myths regarding the process of aging? Throughout history, the process of aging has had a negative association due to several factors, including self-perception and how it was portrayed by the media or socially, and through relative expectations of that time period. What we know today, although our aging society is learning how to live longer, we can change how we view the process into a more positive experience. Some commonly heard myths include most older adults or Americans live in nursing homes. Depression is a normal process, and it's normal to experience that in older adults. Memory problems always mean somebody has Alzheimer's disease. And all older adults are the same. So overall, how can we change our perspective? Living longer can mean more opportunities to be more productive, both physically and mentally. Ability to become healthier. We are able to make better lifestyle choices as we are living longer, and being more optimistic. Reality. Older adults, they're just as unique as you and me. They have varied histories, they have different needs and changes relating to the aging process. They are often seen as having more wisdom, they are more cultured, and they have lived life so far. Many older adults continue to reside at home and enjoy productive lives. They're not necessarily confined to living in a nursing home. They continue to have employment, they drive, operate machinery, equipment, and are very active in their community. Depression is a common mood disorder, and it can occur at any age, but it's not an expected aspect of aging. As we grow older, there are any number of mood disorders that can affect anyone, such as depression, anxiety, post-traumatic stress disorder, just to name a few. And lastly, not all memory problems indicate an Alzheimer's diagnosis, as some conditions can be treated. With an appropriate assessment and treatment, many conditions are manageable at any stage of life. Let's move on to the aging process. Normal aging is what is typically expected to occur across a traditional life course. Everyone ages at a different rate given many factors, such as their genetics and environment. Overall, it is seen as a gradual change in all aspects of our body. You will experience a part of the normal aging process, body changes both physically and mentally, such as aches, pains, age-related medical conditions. You're able to still maintain your independence without assistance, such as bathing, dressing, grooming, maintaining your finances, driving. A part of normal aging, you will have changes in all 5 areas of your senses, including your vision, hearing, speech and language, touch, and taste. And we'll see it as a general decline in cognitive abilities and performance. Some typical examples include, as seen in some of the images here, gray or thinning hair, starting to develop wrinkles, may need to use bifocals, starting to have arthritis, age-related medical conditions factored with some of your genetics and your lifestyle, including diabetes, high cholesterol, high blood pressure. This is considered a typical normal aging process. However, the opposite side of that is abnormal aging. So this is out of the usual path or trajectory normally seen with older adults. Remember, there is a physical and mental health connection with this too. Both of these aspects correlate to one another. If we have poor physical health, that can lead to poor mental health and vice versa. So abnormal aging, you will experience body changes both physically and mentally, which affect your ability to care for yourself with your usual daily living activities and or both complex tasks. With abnormal aging, you may start to see more negative side effects, such as increased rates of substance use disorder, increased rates of mental health, increased rates of suicide, and also increased rates in HIV status. Let's talk about the stages of memory impairment. As we age, we may have periods of forgetfulness and inability for immediate recall, but these usually resolve relatively quickly. However, during periods where you may find yourself consistently struggling to find that right word, or recognize that friend, or remember the task that you're currently doing, it's best to see your doctor for further testing. There are two areas of pre-diagnosis that someone can experience. We have subjective cognitive impairment or mild cognitive impairment. So let's review some of these terms. Subjective cognitive impairment. This is more of a self-perception. It's when you feel or you believe that you're experiencing to have more difficulties with your thinking and memory. It's not often seen by other people, such as your family, friends, neighbors. Again, it's more of a self-perception. Mild cognitive impairment. This is when you or your loved ones and neighbors and anybody that would happen to know you very well, they start to notice the changes with your memory, but not to the extent where it's interfering with your life, your ability to care for yourself. They just see that something seems to be a little off. When to seek help. To truly understand if you have mild cognitive impairment or MCI or any other memory problem, you'll need a thorough assessment and history taken by your doctor or specialists called neurologists and neuropsychologists. You may have lab work, memory testing, and brain scans to help rule out or determine the cause of your memory concerns. Research has indicated that subjective cognitive decline may be one of the earliest ways to identify high risk factors for developing Alzheimer's or other dementias. But please note that if you also are diagnosed with having a mild cognitive impairment, that may be an early sign for Alzheimer's disease, but not everyone with a mild cognitive impairment develops Alzheimer's. So reviewing here some ways to help manage your memory and thinking skills when you start to feel that you have subjective cognitive impairment. You can start to create to-do lists to help serve as a memory aid. Ensure that you are socially engaged, you're eating right, limiting alcohol use, and reducing your risk with smoking. Ensuring that you're exercising to the best of your ability. Ensure that you're getting the right amount of sleep and productive sleep. And overall, controlling your risk factors, such as diabetes, blood pressure, and cholesterol. Now let's move on to aging and how it relates to the neurocognitive process. I would like to provide a brief overview of the brain structures. You can see in the color picture of the brain, we have 6 areas that control various aspects of our abilities to do things with everyday life. From thinking, memory, behavior, movement, with our vision, our language, hearing, controlling our feelings, and with majority of what we do and how we do things, our brainstem, which is more of the automatic, controlling our rate, our heartbeat, our temperature, and certainly also with our balance and coordination. So overall, aging and how it relates to the neurocognitive process. The 6 areas of brain can be affected by various chemical and physical changes, especially with a neurocognitive disease. So let's kind of break down some of the terms here. neurocognition or neurocognitive here. Neuro kind of means the nerves or the nervous system or the pathways that go back and forth. And cognition are structures in the specific processes of the brain. There are two groups and areas of brain functioning referred to as cognitive and executive functioning. With cognitive functioning, that's the main driving force behind our attention, memory, and perception. In our executive functioning, that's the higher level of cognitive processing, more for of a goal-directed behavior. So the areas of concern relating to the neurocognitive process in aging. The areas concern consider for the process of aging here in neurocognitive diseases result around the varied chemical and physical changes that occur to our brain. Scientists, researchers, and doctors have found that there are certain proteins and plaques, which are sticky tar-like substances that build up in your blood vessels, that affects your brain's neurons to functions. Neurons are the nerve cell or electrical impulse. Look at it as a, for the computer here to transmit the data to our brain. So with that, chemical changes, physical changes, we will see a buildup of protein and plaques. The blood vessels to the brain are affected. This leads to the cells not being able to communicate effectively and unfortunately experience cell death, also known as atrophy. And all these changes you can physically see on certain types of scans. So overall, cognitive and executive functions are affected when these chemical and physical changes occur to your brain. But what does this physically look like? We've talked about the chemical changes that occur and how they physically change the structures of the brain. But how can we see this? Doctors will often perform an MRI, more typical to occur than higher level scans, to monitor the disease process. So with the chemical changes, there will be a buildup of proteins and plaques, which will result in losing the neurons or cell death. The medical term is known as atrophy. The physical changes, looking at the pictures. Having these images over a period of time allows your professional team to make a more accurate diagnosis. These are just a few online images that you can reference the physical changes to your brain. You can see progression in the top left image of the disease process. There's an MRI of a normal brain image, someone with mild cognitive impairment in the middle, and someone diagnosed with Alzheimer's disease or AD. In the bottom right, there is an image here of a side view of a brain scan. You're able to see a normal image where the outline of the brain, there appears to be no gaps. But for someone with frontotemporal dementia, another type of dementia, they have voided space or sunken in area in the front of their skull. So just remember, the main area of focus that you can interpret from all these images, interpret that there's cell death, which is indicated by the growing of voided area or shrinkage or loss of volume in the MRI. So with that, this is the cell death, the areas of the brain that are affected and can no longer process the information to function properly. So overall, we want to know, well, why does this matter? How does the changes, both physically and chemically, matter overall to someone? So let's go back to our image of the brain. Let's think about how the changes in the brain will affect overall function. The buildup of the plaques, which are certain proteins found in the brain, are clumping around the neurons, which prevents them from working effectively. Some of these changes also can occur to the blood vessels in the brain. In the end, the neurons are not sending the signals and other means to keep it alive, which causes the cell to die. So how does this change affect our brain? There will be changes in the executive area of the brain, which you would often see the person having difficulty in tasks that require a person's ability to plan, to make decisions, and be aware of their safety and their surroundings. For the cognitive area that's affected by the brain changes, they will have difficulty with attention and memory. But what would this look like? How would you see it externally? So let's consider occasions where you say you may have forgot something that's on the stove or in the oven. This can certainly happen from time to time, but we understand that there are risks associated and often have learned to make the changes necessary to kind of decrease that risk of repeating the same event. When these occur for someone like you or I, we're usually distracted when these situations occur. But it's quite the opposite for someone that's going through a neurocognitive disease process. At first, you may not notice these subtle changes to your loved one's behaviors or how they act, but over time, their ability to have memory, recall, and awareness will decline. Making poor safety decisions. So looking at that, talking about earlier about how sometimes we may make mistakes and leave that stove on or the oven on and forget something's in there. But for someone with a neurocognitive disease process, they may have no idea that they did that. They're unaware of the safety risks. They will often find themselves falling victim to more scams, online scams, phone scams, because they truly believe, they have to do that in order to help save someone or help the situation out. And also, they're wandering. They're not knowing how to return to their house or their car or back to the grocery store. Overall, with poor cognitive and executive processing, the decision making, you will find someone that's going through a neurocognitive disease process having more trouble paying their bills and maintaining their household needs. They're having more difficult time with conversations. They're often repeating what's said, and it's often because they're not remembering the response from what was said before. And you may also find them not caring for themselves both mentally, physically, and emotionally. Now let's review the process of aging and how it relates to a neurocognitive disease process. So we've touched upon the process of aging and how it affects our body as we age, particularly with our brain. Now we're going to discuss the actual neurocognitive diseases. The main thing with this process is that there's no curative properties. It is viewed as a progressive disease, which will worsen over time. Over the next few slides, I'll introduce the varied types of neurocognitive diseases and how they impact our brains. So looking at the slide here, you can see several types listed: dementia, Alzheimer's, Parkinson's, frontotemporal dementia, vascular dementia, Lewy body, and mixed dementia. But first, aren't all types of dementia the same? And aren't these terms used interchangeably? Not exactly, and here's why. Each specific type of dementia includes the relative area of the brains that are affected, along with the key identifiers, the certain proteins, and how they're no longer working effectively. So each type of dementia has certain identified proteins, which during the presentation I will only refer as certain identified proteins. There are various names and gene types and various aspects with the degenerative process that I wouldn't expect you or I to truly know during this presentation. So with that, I will only refer to them as certain identified proteins. Just remember that all these diagnoses are given after a thorough assessment by several specialists. So we will start to define the terms. We will start with dementia. Dementia is the broad definition of a set of diseases that include a primary loss of mental function, along with having deficits in daily life and activities. You can look at the dementia being an umbrella for the varied types of neurocognitive diseases. There are very different types of dementia. The first type of, and the most prominent, is Alzheimer's disease. That's one of the most commonly diagnosed form of dementia, and it's characterized by having a certain identified type of protein, plaques, and tangles in the brain. It involves the area of the brain that controls your thoughts, your memory, and your language. In Alzheimer's disease, some of these changes to the brain can occur up to 20 years, even before the first symptoms would develop. Another type of dementia is called vascular dementia. This is where you will see changes to the brain's blood supply through having a history of strokes or the buildup of cholesterol plaques, leading to the different blood supply, the different nerves and endings to the brain there. Specific types of the dementia continued. Another type is called Lewy body dementia. This is a form of dementia that's characterized by having certain identified proteins, this time called Lewy bodies, in the brain that primarily affects movement, sleep, and cognition and behaviors. Just remember that not all types of dementia and dementia-like diseases are neurocognitive diseases. Some can be the result of metabolic imbalances such as substance use. It can be an inherited disease or even traumatic brain injuries. Depending on the cause, some of these cases can be reversible. For example, when you're encephalopathic, this can happen from various mechanisms in your body that can cause your brain to swell. It often leads to someone looking confused and not like themselves. Again, one of the non-neurocognitive type of disorder. This can occur through someone having diabetes, having a vitamin deficiency, different types of infections in your body can lead to someone having brain swelling and being confused and not being able to walk, not being able to talk appropriately and just interact. Some other causes of dementia-like symptoms include depression, untreated sleep apnea, delirium, side effects of medications, someone having Lyme's disease, thyroid problems, and as stated before, certain vitamin deficiencies through and even excessive alcohol consumption that can also lead to dementia-like symptoms, which again, these are the certain ones that we have known through research and doing medical tests and scans have seen that it can be reversed. Frontotemporal dementia. That is the most commonly diagnosed type of dementia in adults under 60. Frontotemporal dementia is a set of diseases characterized by having, again, the certain identified proteins primarily affect two areas of the brain responsible for controlling your behavior, your language, emotions, and movement. There are three groups of frontotemporal disorders. The types are categorized as behavior and personality, language. Some individuals that have a frontotemporal disorder may experience aphasia, and motor/movement. That's another type or group of frontotemporal disorder. So the related disorders in this category are frontotemporal dementia with Parkinsonian, or frontotemporal dementia with Lou Gehrig's disease, or ALS. Now let's move on to the best practices for help and resources. Throughout the presentation, we discussed the varied aspects relating to the patient, about what it looks like to be diagnosed with the neurocognitive disorder, how that would look on a MRI scan, how the individual would exhibit some of the behaviors in order to be diagnosed. But let's focus on some aspects for their loved ones who are often the informal caregivers. Mothers, daughters, sons, and fathers often find themselves as the caregiver. Sometimes this is not planned for. It is certainly a difficult time of transition and will elicit varied emotional responses. With support from a team of dedicated doctors, nurses, specialists, including care managers and social workers, it's best to begin providing information as early as possible. What's included in the next few slides would be a general outline of services typically needed. Just remember, this can be a lifelong process that is progressive and degenerative, with more support needed at times for the caregiver than the patient. So best practices. Let's look here. Caregiving is common and its value is under-recognized. Unpaid assistance is an estimated 18 billion hours in the year 2022 in a value of $339 billion. So by the year 2050, the projected cost of Alzheimer's will be nearly $1 trillion. After the initial evaluation and diagnosis, you and your loved ones are often faced with many questions and feelings of uncertainty. During this period, it is best to become established with the following resources. The first one I like to refer to is their local aging office or elder services locator. Online, you can find material at the National Institute on Aging, especially for your local aging office. They can certainly assist you with information, referral, and support for adults who are qualified for services. Specific dementia services. My main go-to site would be through the Alzheimer's Association. They help provide support, services, education to individuals and their families and caregivers who are affected by Alzheimer's disease and the related dementias nationwide. That is, like I said, usually my first stop for anyone that's diagnosed with a dementia diagnosis. They have support groups both in person and virtually, and there are specific disease-specific websites. And your medical team and professional can assist with finding them further for you. Another area to look at is the medical and legal services. When diagnosed early, it is considered best practice to establish medical and legal documents within your state's guidelines. Through the Alzheimer's Association website and sponsored by AARP, if you use the Community Resource Finder, you're able to locate resources near you. Some medical and legal topics to consider are advanced directives, including the Durable Healthcare Power of Attorney and Living Wills. In Pennsylvania, we utilize the POLST, which is a portable medical order specifying your end-of-life care. You also want to review and discuss an out-of-hospital do not resuscitate order, and also elder law services for estate and financial planning. Now let's look at social work approaches and consideration. Over the last 50 years, society has seen an increase in our aging population with continued expectations for growth. Subsequently, this is changing our demographics with how we must meet the increase in demand for food, housing, and services both financially and logistically. In particular, There are social work theories and perspectives that can help us understand the basis of working with an aging population. Theories on aging. While there are several theories available, however, there's no one set or agreed upon perspective on theories on aging. But I just want to point out a few of them that we might have had through our undergraduate and graduate education. They are split up into different aspects of our biopsychosocial development. So we have social theories, including disengagement, activity, and continuity. And then we also have the developmental stages. Disengagement theory was considered the first sociological theory on aging, created by Cummings and Henry in 1961 in their book Growing Old. So disengagement theory is viewed as we age, we tend to voluntarily withdraw from more socially directed activities to something more self-focused. As the individual or the patient or that person starts to realize that, death is almost certain and their times remaining on earth is limited. I would think, and it's my understanding with this theory, it tends to assume that there's a bias towards older adults as they no longer have value when becoming older, that once you lose your knowledge and skills or functioning, you're no longer needed in society anymore. Activity theory. Continued physical and mental activities are necessary to be considered successful in the aging process. And continuity. Our personality and behaviors remain stable over our lifetime, which reflects the level of engagement that you will exhibit when you're an older adult. So if you are active in your earlier years, in your 20s and 30s, that's going to be reflective when you get older in your 70s and 80s. Now let's review some developmental stages with Erik Erikson. We are particularly looking at the 7th and 8th stages, generativity versus stagnation, to be generative or to have value in your life, to be a mentor, to raise children, just overall be productive for generativity. Versus the stagnation, which is often seen as being uninvolved or just disconnected from yourself and society as a whole. Typically, we see that developmental stage from ages 40 to 65. And then the 8th stage is known as integrity versus despair. Integrity, one would view that as having a meaningful life, that we've done something for ourselves, that we have something to show that we've been fulfilling our life. Versus despair means, the acceptance of getting old and we're going to need care and we're going to be a burden to our loved ones and eventually die. This is normally seen starting at the age of 65 and ultimately until our death. So how have any of these theories changed and what remains the same? So some of the theories mentioned before have certainly shifted perspective, in particular with disengagement theory. Research has indicated that individuals disengage from society by the means of health or personal reasons created by the varied circumstances in our own life. So the cultural shift, we're learning that our aging population has an effect on misguided assumptions, as mentioned here by the disengagement theory. Older adults continue to remain productive, they're engaged in their life, they have meaningful relationships, and they certainly contribute to society today. The process of aging is a lifelong process that is seen by changes in both chemical and physical aspects, which is typically considered the normal course if achieved as anticipated. So let's look at some future considerations. Education and training. More education and training would be appropriate and would appreciate to have more opportunities in the field of aging, to definitely have paid internships, additional licensure, and just more coursework in our undergrad and graduate levels of education. Looking at our code of ethics. Our code of ethics utilize our values to continue to advocate for older adults' needs, such as any barriers to treatment. Looking at research. Enhance research opportunities at all levels to include the mental and behavioral health needs, along with continued research surrounding ways to treat neurocognitive diseases. Let's look at some funding. Funding. Continue to advocate and lobby for increase in funds, both locally, statewide, and federally, for various programs that impact older adults, such as funding for a local aging office, for Medicare and Medicaid, adult day centers, just to name a few. And lastly, earlier screening and assessment. Through professional education, training, and research, we would like to establish earlier outreach and prevention, ideally in a centralized location for the older adult population, such as at their doctor's office, at local senior centers, just wherever is easily accessible for them. Although this is not an inclusive list, these are just some of the ideas surrounding how social work professionals can continue to advance the field of aging and neurocognitive diseases. I'd like to take this time to wrap everything up and provide this little bit of information regarding Alzheimer's disease. Alzheimer's disease and the related dementias is a worldwide epidemic. The disease process continues to affect millions of individuals worldwide, with an estimated 6.7 million affected in the United States alone. With early recognition and awareness, the ongoing need for trained professionals, the hope for a cure still remains. Well, I hope you were able to understand and have a brief overview of the neurocognitive disease process and how the aging process impacts that. In the end here, there will be a post-test and some questions to answer. Thank you so much and have a great day.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.